Welcome to Eat, Move, Think. I'm your host, Dr. Peter Nord, Chief Medical Officer at Medcan. I wanted to dive into an exciting and rapidly evolving topic, the science behind predicting disease before it strikes. Imagine if you could know years in advance that you're at risk for a certain illness. What if you had access to the tools and information to take action now to prevent it? Well, that's exactly what we're going to be exploring today. The role of biomarkers, genetic screening, and advanced diagnostics in predicting your risk and how we can use this information to stay healthier for longer. This is also known as improving health span, the length of time we live in good health, ideally into our 60s, 70s, 80s, and beyond. So way more than just lifespan. To start, let's break down the terms precursors and biomarkers. A precursor is essentially a signal or indicator that something might be happening in the future. Think of it as a very early or very quiet warning sign that tells us we're on a path that could lead to disease. A biomarker, on the other hand, is any substance, structure, or process that can be measured in the body. So really, it's a measurable test that indicates a certain biological state or condition. These could be things like cholesterol levels, blood pressure, or specific proteins found in your blood. So a precursor could be something like sleep. So if your sleep quality is really bad, that's a precursor of something bad that's going to be coming down the pike, because we know that having poor sleep quality ends up affecting your overall health and well-being. The biomarker could be something like cholesterol. That's a marker for future atherosclerosis, plaque buildup, which can result either in a heart attack or stroke. Poor sleep quality has been associated with many diseases, conditions, and disorders. Certainly there's a connection to mental health, for sure. If you're not getting a good night's sleep, you're probably not going to be functioning just 100% during the day. And in terms of diseases, things like neurodegenerative diseases like dementia, cognitive challenges, they're directly related to poor sleep. But even something as common as blood pressure, individuals that aren't getting a good quality sleep end up having higher blood pressure as a result. By identifying these biomarkers early, we have a chance to intervene before disease fully develops. All right, so how much do our genes influence health? The old nature versus nurture question. Genetics plays a fascinating role in disease prediction. We all inherit certain traits from our parents, everything from the color of our eyes to our height. But we also inherit certain genetic markers that can influence our risk for diseases like cancer, heart disease, or diabetes. One of the things that's really important that we always ask as part of our annual health assessment is family history. Understanding your parents' health has a lot to do about your own health in the future. So that's an important thing. Understanding, did your parents die under the age of 65 of a condition that is inherited? That puts you at much higher risk for the same thing. Consider this. What if we had a genetic test that was able to say with 100% accuracy that you were going to get a particular type of cancer in the future? That would really get your attention. Now what if you had a test that gave you a 50-50 chance? Or what about a 10% chance? Different approaches for sure. And this is why it's critical to have a genetic counselor work with you and your doctor to make informed decisions. This is way more than 23andMe. One of the most talked about examples of a genetic test is the BRCA1 and BRCA2 genes, which significantly increase the risk of breast and ovarian cancer. If you have these genetic markers, you're not guaranteed to develop cancer, but it means you have a much higher risk. Knowing this information can empower you to make proactive choices, such as regular screenings, lifestyle changes, or even preventative treatments. But genetic information goes beyond just identifying risks. It can also guide us in choosing the most effective interventions. For example, some people metabolize certain medications differently based on their genetic makeup. That means that a personalized approach to treatment can be way more effective. We've all heard about the nature versus nurture, and that really applies to pretty much every disease. Every disease has a unique relationship with genetics versus what's happening in the environment around or lifestyle. And in fact, we're finding out that what happens around you, the nature versus nurture, can actually affect your genetics as well and actually modify your DNA. So we're finding now that the relationship between genetics and the environment and your lifestyle is a little more complicated than we initially thought, but for sure every single disease process can be benefited with a positive viewpoint on life and lifestyle. Now let's talk about the cutting-edge technologies that are helping us understand our health better than ever before. Advanced diagnostic tools are rapidly evolving and allowing us to detect potential health problems long before symptoms appear. These tools can range from high-sensitivity blood tests that detect inflammation or cardiac risk to imaging techniques that visualize early stages of disease. For instance, the HS or high-sensitivity troponin test is a breakthrough in cardiac health. It's a highly sensitive test that helps detect minute levels of troponin, a protein released when the heart muscle is damaged. This test can identify heart issues years before they become life-threatening, giving doctors and patients valuable time to take preventative measures. One of the things that we're thinking about adding to our Medcan annual health assessment is a health score, really something that's made up of, let's say, 9 biomarkers. So basically you get a score out of 50 and a series of recommendations on how to improve your score over time. These biomarkers are the ones that are most highly correlated with living well for longer. There are also diagnostic tools that can measure the levels of certain blood biomarkers associated with long-term health risks, such as continuous blood glucose monitoring, or CBGM, or specific inflammatory markers that indicate a propensity for developing metabolic diseases like diabetes. So how can we use this information to prevent illness? Well, knowing your risks is only the first step. The real power lies in using this information to prevent illness before it actually happens. You can do that with a personalized plan of care. With information from genetic testing and biomarker assessments, you can work with your healthcare provider to create a personalized health plan based on your unique risk factors. This might include changes in diet, exercise routines, medicines, sleep habits, or simply more frequent health screenings. Many diseases are influenced by lifestyle. If advanced diagnostics indicate you have early plaque buildup, for example, this is a signal to adopt heart-healthy habits, like eating the Mediterranean diet, reducing stress, and exercising. And I mean, every single day, exercising at least 30 to 45 minutes of cardiovascular exercise has definitely been shown to improve your risks associated with cardiovascular disease. Regular monitoring and follow-up is also important. Once you know your risk factors, it's essential to keep an eye on them. Regular monitoring of biomarkers like cholesterol, blood sugar, or inflammatory markers allows you to track your health over time and make adjustments as needed. At a minimum, this needs to be annually, but the best outcomes are with regular quarterly check-ins. And then preventative treatments. In some cases, having a genetic predisposition or certain biomarkers might indicate the need for preventative treatments. This could mean taking medications to reduce the cholesterol or your blood pressure, or even exploring options like preventative surgery for those with high genetic risks for certain types of cancers. So that's primary prevention. And then if we find out that you do have an issue, we move to secondary prevention, which is making sure that the issue doesn't get any worse. So what does all this mean to you? It boils down to one essential idea: knowledge is power. By understanding the early indicators of disease and taking action, you can significantly improve your chances of living a long and healthy life. It's not about predicting the future with 100% accuracy. It's about being proactive and making informed choices about your health so you can live longer and live healthier. Well, that's it for today's episode. If you found this episode helpful, make sure to subscribe and share today's episode with someone who might benefit from this information. Remember, your health journey starts now. Take action today for a healthier tomorrow. Until next time, stay informed and stay healthy.
This podcast episode is intended to provide general information about health and wellness only and is not designed or intended to constitute or be used as a substitute for medical advice, treatment, or diagnosis. You should always talk to your Medcan healthcare provider for individual medical advice, diagnosis, and treatment, including your specific health and wellness needs. This podcast is based on the information available at the time of preparation and is only accurate and current as of that date. Source information and recommendations are subject to change based on scientific evidence as it evolves over time. Medcan is not responsible for future changes or updates to the information and recommendations and assumes no obligation to update based on future developments. Reference to or mention of specific treatments or therapies does not constitute or imply a recommendation for endorsement. The links provided within the associated document are to assist the reader with any specific information highlighted. Any third-party links are not endorsed by Medcan.